Hi guys and welcome back. We're here at our next video, 1.2, which is going to be pregnancy week 1. We kind of already talked about this just because of conception and like what happens in your month. But before I get into that, I'm just kind of going to explain what to expect out of these. We're going to do them week by week. Basically, what's going on in your body, what kind of symptoms are you having, and just in general, what's going on with baby, and how are you feeling on the outside. Later, at the end of the trimester, it just makes sense to do it by trimester and trimester. I'm going to talk about doctor's appointments and tests that you expect in the first trimester, some weird things to look out for and risks, and then what you should be doing to your body, health-wise, exercise-wise, that kind of stuff. I'm going to be doing that trimester by trimester, simply because that makes a little bit more sense if you think about the pregnancy as a whole. Doing it week by week just doesn't necessarily make sense, especially in the beginning. So, week 1 is essentially right after your period. Even though you're shedding an egg and you're shedding that wall, it's starting all over again up in the ovary, So that egg is releasing, and FSH is now going to turn itself into progesterone to tell that wall to re-thicken because another egg is getting released, and in 2 weeks, that's going to be ovulation. Those hormones are going to be proper and perfect spot for the sperm and the egg to meet. Again, you want to have that meet in the fallopian tube. So week 1 is essentially in the process of pregnancy right after your period, which is why they ask when your last period is. And this is when your egg is releasing, and ideally within week 1 and 2, which I'll talk about next video, is when the sperm is going to be entering the uterus and fallopian tube to be meeting. At this point, you want to have a lot of intercourse so that there's lots of sperms, lots of chances going on in these 2 weeks after your period. Essentially, in those 2 weeks, that meet and greet is going to be happening. And you really want that to happen in those 2 weeks. So by the time that this ovulation has reached its perfect peak hormone-wise, the sperm has already met the egg. So the setting is right, the egg and the sperm have already met, and now it's time to make that zygote and just divide. So the blastocyst is ready by week 3 or 4. So week 1 is really just step 1 technically in pregnancy, but it really is just after your menstrual cycle and starting the cycle over again, because that is essential to be able to start a period, which is why they ask you when your last menstrual cycle was, because essentially that is week 1. But not a whole lot is going on. You technically don't have a baby. Egg and sperm technically really haven't necessarily meet. But during this time, you really, if you're planning, you really want to plan from the day that your period ends to 2 weeks later, which is going to be your ovulation. The day your period starts, 2 weeks after that. But the day your period ends until ovulation, you really want to be having as much intercourse as possible, so there is lots of sperm to have lots of chances to meet the egg that is being released, and the wall is already starting, the progesterone is rising. Some symptoms that you can expect is your BBT, or your oh goodness, I forgot the first word, but base temperature, which is essentially your internal temperature by your vagina, is going to drop all of a sudden and then spike back up. This is mainly going to be happening in week 2, but kind of towards the end of week 1, week 2. That's technically when your ovulation is starting, so your temperature is going to be fluctuating. So if you do take your temperature, you're going to notice that, and it's going to go to the lowest degree right before ovulation, and then the highest degree those first few days of ovulation. And those are technically the prime time to have intercourse. But I always like to say and throw out there that you really should be having intercourse this entire time, so that there's sperm living inside the uterus already those days. So you're not necessarily counting on day 1, but you already kind of have sperm, and then you're having sex in that beautiful perfect window, so it's kind of pushing more up. And even after, because those are those perfect, it's just giving yourself more of a chance to be able to get pregnant, essentially. And so week 1 is not a whole lot. It's mainly going on with the female body. And as many individuals that have vaginas and a period know, your week to 2 weeks after your period, you have a lot of cervical mucus. A big reasoning for this is mainly hormones, but another reason is technically a primal instinct of our body to prepare for, the journey of the sperm and the egg, and making that much easier, making everything lubricated and nice and perfect and ready for the sperm to be entered into the uterus and fallopian. But yeah, that's basically all week 1 is. It's just technically that. And then we'll move on to week 2 next episode. These episodes won't be very long week by week. That's why I'm going to do them a couple times a week versus only 2 times a week. My longer videos I'll probably only do more like 2 times a week. But week by week, they're not that much to say outside of, the usual, since it's week by week. And then those weeks that we'll be talking about doctor's offices, risks, and what you should be doing during your pregnancy. Meaning that portion of your pregnancy, like that trimester. Those will be a little bit longer of videos, so those might end up being only 2 episodes a week. So 2 to 3 times a week I'll be posting. But yeah, so I will see you on Thursday for week 2. Comment below if you have any questions. Thank you.